Welcome back, everybody, or for those of you, welcome. For those that are just joining, my name is Tina Costa. I am a director with the PHSA Office of Virtual Health, continuing to be your host for our virtual sessions today. It's my pleasure to welcome you or re-welcome you to day 2 of the 2023 BC Digital Health Forum. For those of you joining in our virtual circle, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. As we continue to engage, to learn, and to collaborate in the realm of digital health, let us give thanks for the privilege to do so on these beautiful and sacred lands. And may our discussions contribute to a future where Indigenous voices are uplifted and the principles of reconciliation guide our path forward. I now have the pleasure to introduce our next presenter, Mark Ansermino. Mark is a professor in the Department of Anesthesiology, Pharmacology, and Therapeutics at the University of BC. He is also the Executive Medical Director for Global Health at BC Children's Hospital. Mark was a Michael Smith Foundation for Health Research Scholar and past winner of the Brockhouse Canada Prize for Interdisciplinary Research in Science and Engineering. He leads an interdisciplinary research team of engineers, researchers, and clinicians who are developing and evaluating novel mobile health applications to improve the health outcomes of women and children around the world. Please join me in welcoming Mark for his talk entitled here, The AI Hype for Clinical Decision Support in Healthcare. Welcome, Mark.
Thank you very much, Tina, and it's a great pleasure to be here, and thank you very much for the invitation. I have had the pleasure of listening to a lot of presentations of the last couple of days, and I think that you will all agree that AI is the big topic in digital health, but I think it's even more than a big topic in digital health. I think this is going to be a huge topic in clinical care as we move forward. So I thought, rather than talking about some of my research, I would talk a little bit about my thoughts around about AI and digital health and what the future will look like. I think this is a very important topic, and I hope that I can put a good perspective forward. And I spend most of my time these days trying to connect the dots in digital health, and particularly around AI. So the main disclosure I have is what I have to say today is very much my personal opinion. I'm not representing any of the organizations, UBC or PHSA, where I work. So if I'm wrong, please blame me and not those organizations. But this is really trying to have a look a little bit about what's happening around AI in healthcare, and particularly around decision support and where we actually are moving towards. I really wanted to position this talk as being accessible for those of you who don't really know a lot about AI. So please bear with me, those who are more expert than I am in this, but I thought I needed to start off with defining a few terms. So first of all, what is AI? And this is really the ability of a digital computer or computer-controlled robot to perform tasks commonly associated with intelligent beings. So this is a huge topic. And, we've tried to create these sort of diagrams that try to explain all of these terms that you would have heard used in reference to AI. And AI, or artificial intelligence, is, the outer circle. So within this, we have machine learning, where there's lots of methods. And even outside machine learning, we have a lot of statistical methods that would be considered AI that aren't necessarily machine learning. We then have the neural networks, which are, revolution that happened within the AI community, and then deep learning, which is like the deepest, most, and certainly where a lot of what we're talking about today will be in this realm of deep learning. There's lots of other terms that have been used, strong AI, generalized AI, narrow AI, augmented intelligence, augmented individualized medical support that are relevant to us. And I just want to acknowledge that there's a lot of confusion around this. So what I really want to concentrate on today is generative AI. And generative AI uses unsupervised learning and generative models to create new original content, such as text, images, and audio. So you appreciate that this is just a component of AI that sits pretty much all within that deep learning space. Okay, and this is specifically focused on large language models, or as we call LLMs. So a large language model is a specific natural language processing, or NLP model, that predicts the next word or token. It has also now been applied to images and audio and other contexts, but that's specifically what it is. And I think that Wheel of Fortune is a perfect example to try and illustrate this. So essentially you have a whole lot of letters here, and you're trying to predict what this phrase actually is and allow your brain to work out what's the most likely letters that fit in there. And the way that we do this is we essentially look at all the data in the world, and that's pretty much what these big models have done. And from this, try and predict what the next token should be. So you need to learn some other terminology that goes with this, and I'm going to go through some of that very quickly. You have a token, which is really how we take either a letter or a combination of letter or even a word. We then embed that in some digital form. Those digital forms then are put into vectors, and these vectors describe the relationship between these embeddings. And then to describe all of this, we have parameters. So these are different to the parameters that you may have learned about previously. And then what we actually do is we approach these models using what we call prompts. So we describe prompts that we have as we try to interrogate these models in understanding how they actually work. So those are some of the words we're going to look. And this is just an amazing image that I downloaded a couple of days from Information is Beautiful, that really shows you the explosion that's happened in the world of generative AI. So first of all, on the left-hand margin here, you have the number of billion parameters. So you can see that most of these models have so much data that goes into them, these billion and billions of parameters that go on to describe these models. And you can see before 2021, there was almost nothing happening. And over the last 2 years, we've seen this huge growth in the number of parameters that we use in the model, but also the number of different models that have happened. And of course, the size of these things are really circles are really the size of the model. The shape really is to show that it's open source if it's a diamond, and it's a proprietary, not open source if it's a closed circle. But you can see that these models have just grown, and this growth is not going to stop. This is something that's going to happen very quickly, not only in healthcare, but everywhere in our lives. And in addition to this growth in these large language models, as we call them, and these are general models. So these are models that can really do any text or any image or any audio. We're looking at apps that really sit on top of these AI models. And OpenAI have called these Assistance API, which is their version of doing this. But there's many, many companies that are working on this. So they're looking at tasks that we do every day and putting apps on top of this that enable us to have access to these large language models. So we don't have to be the prompt engineer that creates a customized prompt. All of these applications are sitting on top of that. And I must confess, and I'm very proud, in fact, to say that I use AI every single day in everything that I do. Whether this is around my research, writing, translating, asking for brainstorming support, there's many things that I do around these apps that sit on top of AI. And I'm sure all of you do. I mean, your basic desktop apps are now becoming these apps on top of AI. However, there is real concern about how fast this is going. And of course, there was a lot of activity in the internet world around Sam Altman and OpenAI that happened this last weekend. But a lot of this was really driven around these concerns that AI is really changing things too rapidly. And a lot of these large language models are not necessarily transparent in what data they used, how they're making these predictions of the next word, how they're actually doing this and how well they're doing it or how badly they're doing. So there's this Foundation for Model Transparency Index that have tried to rate these models. And even Llama 2, which is an open source model, only gets a score of 50%. So we've got a long way to go in improving the transparency about what's happening with these models. And of course, all of this is really prone to this Gartner hype cycle, which is really what I want to stress today. So with any new technology, and this has happened for generations around the introduction of technologies, we have some initial trigger technology that happens, and then all of a sudden, everybody believes that this is going to change the world in every possible way. And this reaches a peak of inflated expectations. And we're certainly heading there with AI. But the reality is that we need to go through then the trough of disillusionment, where all of a sudden we realize that this hype overemphasized what the potential of the technologies were. And this is really just a reflection of us as humans. We as humans are overly optimistic in thinking of what technology will be able to do. And this is particularly true in healthcare, where it's a very complex system that we're trying to introduce technology into. And I would warn you, caution you to be expectant of having this trough of disillusionment. That being said, they're still going to go to the slope of enlightenment and productivity that we can maybe get into a little bit about today, but that are going to be the next cycles that we're in. So just to have a look at what the problems are with AI, and it's very easy to look at this as an iceberg phenomenon. It's very easy to see of what all the potentials of AI are going to be, and particularly this generative AI around prevention, around health promotion, healthcare delivery, drug discovery, treatment, cure, to reduce costs, to extend life. And essentially, there's lots of positive things that we can actually see. But sitting below this is really the other concerns. And obviously the existential concerns around this risk of superintelligence is definitely there. And this will be a whole lecture on its own. But I want to concentrate much more on the sort of more practical things that we will see every day in our lives as vendors come to us as our, and say, look, the system is going to be brilliant. As we read papers around what AI is going to do, we must realize that there's lots of issues in using AI. And certainly one of the most concerning is pure accuracy. And this is particularly a concern around these generative AI models. And the reason for that is these are what we call black boxes. So with these models, we have some input that we put in, this prompt that you put into the AI black box, and you get some output. And you have no idea how that output came. And all of us were blown away when we start using some of these newer generative AI models. But still, there's a lot of uncertainty on how we actually got this model. And so we've certainly seen in all the applications that are coming, particularly in healthcare, where we require really high levels of performance when we're making decisions about patients, that poor precision is a real problem. And people, the solution for this in the past, if you've seen, has been to increase the number of parameters, to get through these billions and billions of parameters, which have significantly improved performance. However, the future for that is going to look different, okay? So we need to be cautious about this. We also need to be cautious about bias. And this has been stressed in many areas around racial bias, but there's lots of other biases that come into play in this. There's the risk of misinformation, that somebody can use this either intentionally or unintentionally to provide the wrong information to the patients at the wrong time. And this concept about autophagy, I think, is raising additional concerns. And this is the idea that as more and more of the content of these big generative models become generated by the models themselves, the performance degrades. And we already see this today, and this is termed autophagy. They're eating themselves. There's obviously all of the risks around security, cybersecurity particularly, and privacy that come from using AI. And remember, you need to send the patient's data into some space, and you then need to get advice that's coming from somewhere outside of your organization. So are we headed for the AI wreck? And this is an AI generated model of what this wreck should look like. And one of the major problems we have with this is which has been called the magical thinking in AI. Magical thinking is a term that we use in anthropology and other areas where basically there's a disconnect between the cause and the effect. So, if you cross your fingers believing that your sporting team is going to win the game because you cross your finger, there's a total disconnect between the cause and effect. And this has been shown in technology in so many ways. And Arthur C. Clarke had this as his third law, that any sufficiently advanced technology is indistinguishable from magic. So this really means that we as humans are very easily captured by this idea that it's going to solve all of our problems. And this is really centered around the thing that's been discussed in a couple of these talks around trust. How do we actually trust these technologies? So where are we in healthcare at the moment? So the FDA has approved by October 19th of this year, 171 artificial intelligence and machine learning technologies. Most of these have been in image recognition, in radiology and related specialties, and none of these use generative AI, and none of these would I classify as being used in clinical decision support that I as a clinician would use frontline in my everyday clinical practice. And there's a lot of reasons for this, but a lot of them are going to come around the regulatory pathways. I can't spend too much time on this, but this is a great document that's put out by the FDA that really tries to decide what kind of AI is going to need to be regulated as a device. And this is really going to mean that it's going to require approval processes through the FDA, which is, first of all, very time consuming, but also is very expensive. And essentially, most things that you will see promoted as being the benefits of AI will need to go through this process. So unless this is really just some increase in information that you're providing to the patient, most of it's going to be required to go through these processes. Remember that a lot of these errors have already happened. There was the IBM fiasco with Watson's. Obviously, I assume a lot of you tried out Babylon, which was this app that was going to help us in our province, which has now failed and gone into bankruptcy. And probably one of the most concerning things was using generative AI as a chatbot by the National Eating Disorders Association really has shown harmful effects that this can have by giving inaccurate or hallucinating information to patients. There's a huge amount of regulation that's coming along and guidance around how to do this. WHO has put out documents, the National Academy of Science, even the Royal College of Physicians in Canada has put out guidance. There's a lot of regulation that's going to come around this. And this is going to be hugely challenging for all of us trying to decide, what do we do? Like, what are going to be the next technologies? So I want to give you my personal view of what I think is going to happen, or where I think we should concentrate. And the document that I found really helpful was this document called The Clinician of the Future. So this is done by Ansermino, which is one of your big healthcare publishers, and they surveyed thousands of patients in over 100 countries around the world. And they came up with these 5 points, which I think are very pertinent to what we want to do about developing technologies. So what did the clinicians want? They wanted a clinician as a partner for health. So in other words, instead of this being a hierarchical relationship between the patient and the physician, this needs to be the patient as an equal partner in healthcare. They wanted to focus on total health. So this is not just dealing with acute healthcare, but treating healthcare as a total lifestyle wellness choice. They wanted the clinician that was tech savvy. They appreciated to achieve a lot of these things. We needed the clinicians not to just have tech support, but for the clinician themselves to be tech savvy. It was important for the clinician to be balanced. And what they meant by this is the clinician shouldn't be the old style clinician that spent 24/7 looking after patients and weren't able to live a healthy lifestyle. And they wanted the accessible clinician. So somebody who the patient could access and have time for that communication to happen. And the only way that we have any hope of achieving that is to totally change our current healthcare system, largely supported by technology. In all of this, we're going to need to have really trustworthy pathways to actually be able to do this. So this is one of those pathways that's been promoted by the OECD. And this is traditionally what we as people who develop device technologies have been doing for many years, but all of this is going to need to be done for AI. So what do I think are the low-hanging fruit in this, or the possible things that happen? And a lot of this was informed by this article out of the Harvard Business School, which is really providing the evidence for the effects of AI, knowledge worker productivity and quality. This is not in healthcare, but I think that we can do this in healthcare. And it's around two important things. The one is productivity and the other one is quality. So there's good evidence that AI can help us with this. And this is going to be around reducing errors, improving the quality of care that we do, but largely around improving its efficiency. So how can we save time? How can we reduce cost? How can we improve workflow? And I think we need to keep a strong emphasis based on the previous points around empathy. And Eric Topol wrote a great article about this a couple of days ago, is like, how can technology really try to make this patient-doctor relationship more empathic? One of the other key points that I think becomes part of this is something that I've had the pleasure of working on for the last 20 years, is how we can use feedback. And this feedback can be at any scale. It can be feedback that can happen within seconds to feedback that can happen with days to improve the AI models that we start off with, that we're using for this clinical decision making. And I believe this is going to be the foundation of improving this model. So it is the current model that we use today to make decisions about patients. I get feedback from patients, therefore I change the decision we make, or we try one thing, we change it. This is very individualized, and this overcomes a lot of the natural variability. So the feedback is based on the individual patient rather than just dealing with some model that is for the whole world, for the whole population. And I believe that automation is going to be the key element that we can put in there that's going to help us to save some of that time using this feedback, both in real time and pseudo real time, as we make these systems smarter. Thank you very much. I'm very happy to hear questions, and please contact me. I'm still trying to connect the dots. Thank you.
Amazing presentation. Thank you so much, Mark, for your thought leadership on what is a really important dialogue in healthcare right now, and just in general, highlighting not only the different types of AI, but the current evolution and where we're at, and how we might expect to see AI tools supporting clinical care in the future. Really appreciate it. We have time for one question, but I know there's probably more, so we'll just reiterate to reach out to Mark if you have one. You spoke a little bit about this, but the question is, what do you think about Eric Topol's work on the use of AI in healthcare with regards to rehumanizing healthcare?
Yeah, thank you very much for that question. And you'll notice that was my reference right at the bottom of my post about empathy. And I think that that's exactly where that thought is coming from. I really enjoyed that editorial greatly. I think Eric is a great thought leader in all of this. And I believe that this is possible. And it's obviously like, this is a fine line that we walk. Obviously, one of the big concerns about healthcare is that we're going to have all of these chatbots appealing to us emotionally and using that really human weakness that we have in some ways to take advantage of us. But obviously, on the positive side, we can certainly use some of these capabilities of AI as you say, to really deal with that rehumanization of what we actually do in healthcare. It's going to be a very fine line for us to actually be able to walk down. But I think there's a huge amount of really exciting research that's going to come out around this area. Thanks very much for your question.
Thank you again. Really appreciate your time. We will close this session now. For those of you in the audience, you'll see the poll come up, and we will invite you to the following session. Our next session coming up is entitled Discharge Care Using Readily Available Clinical Data, the Smart Discharges Approach. Thank you again, Mark.